operation I'd like to talk to you about is something called the SADI, S-A-D-I, or loop SADI operation. This is a newer operation. It has been around for a while, but the ASMBS, or the Association of American Society of Metabolic and Bariatric Surgeons, which is our association or academic association where we do a lot of research and set guidelines for bariatric surgeons, considered this surgery as a primary procedure back in 2020. So with that, what we do here, and this is personally one of my favorite operations, what we do here is we do a sleeve gastrectomy like we had discussed earlier. With that, in addition to the sleeve, when we talked about the bypass, we talked about the rerouting of the intestines. That really helps for maintenance of long-term weight loss. So what we do here is we divide after the first part of the intestine called the duodenum, and we divide that, and then we count backwards around somewhere between 250 to 300 centimeters, and that is based on your total bowel length that we count during the surgery, and then we make a looped connection here between the first part of the intestine and the last part of the intestine called the ileum. So what that does, it allows us to get more weight loss than either of the previous surgeries. And the percentage that we talk about with the SADI is somewhere in the realm of about 35 to 40% of total body weight loss and around 80 to 90% of excess body weight loss. The benefits of that also, when you compare it to the bypass, is that we keep the muscle in the stomach called the pylorus, which is right here, which holds foods in the stomach so that you retain your restriction feeling forever. We also, with that pylorus, helps prevent that dumping syndrome that we talked about. The other thing is, because we're connecting intestine to intestine rather than stomach to intestine like the bypass, we avoid the risk of ulcers, so there's no restriction after about 3 months on taking the ibuprofen, Aleve, or the NSAIDs that we talked about. The other thing is there is a risk of internal hernia with this operation as well, but since we're not dividing the bowel downstream and we're bringing up a loop, there is less of a chance of an internal hernia. So I like this operation a lot. We are still learning about it because it is relatively new, but there is a lot of good data on it. And I do recommend this operation for patients that have higher BMIs or that have had a sleeve and are looking into doing a revision surgery, and those patients that have other comorbidities such as diabetes, high blood pressure, because the improvement in those types of illnesses is significant when it comes to this operation. All the operations that we do improve your high blood pressure, diabetes, sleep apnea, high cholesterol to a significant amount. And that is, again, one of the main reasons why we decide to go down this route. Some of the complications that you can have with the SADI, the same ones that we talked about with the sleeve apply here. However, we do see patients sometimes develop what we call bile reflux, because the bile that is flowing from the liver here, it then crosses this connection where you can get reflux up into the stomach. Also, some patients still have gastroesophageal or acid reflux as well associated with this operation. Overall though, very good operation. Again, patients usually stay 1 night, maybe 2 nights in the hospital, and again, it is done